आइए।
Hi, good afternoon, ma'am.
Good afternoon.
Ma'am, doctor is here. So, Kavita will start with the introduction. Hi, good afternoon.
Sure. Doctor is here.
Good afternoon. Ma'am, doctor is here. So, Kavita will start with the introduction. Hi, good afternoon.
Sure. Doctor is here.
Good afternoon. Ma'am, doctor is here. So, Kavita will start with the introduction. Hi, good afternoon.
Doctor is here.
Good afternoon. Hi, good afternoon, doctor.
Good afternoon.
Myself is Sandhya Sharma, doctor, and I'm now handing over to Kavita. She'll start with the introduction and then we can start with the session, sir. Kavita, please.
Yeah, sure.
Good afternoon, everyone. Kavita Sharma here from Hello Kids office, head office. Always a delight to connect with you all. Today we feel honored and privileged to have with us a highly respected expert in pediatric cardiac care, Dr. Rajat Gupta, consultant, Department of Pediatric Cardiac Science, Fortis Hospital Mohali. To start with, allow me to introduce his remarkable achievements and profile. Dr. Rajat Gupta, MBBS, DNB Pediatrics, FNB Pediatric Cardiology. Sir is currently heading a pediatric cardiology unit at Fortis Hospital Mohali, which is the largest unit in the private sector in this region with very good numbers of pediatric cardiac intervention and pediatric cardiac surgeries being done every year with patients coming from North India, Afghanistan, Iraq, and some South African countries. He has a keen interest in congenital heart intervention, especially neonatal intervention. Today, he will be guiding us on very important and relevant topic, heart healthy kids, what every parent must know. So please join with me in giving a warm welcome to Dr. Rajat Gupta for his first Hello Kids YouTube live session. Over to you, sir.
Thank you so much. And thanks for introducing me to the group. As ma'am has said, so I am a pediatric cardiologist at Fortis Hospital Mohali, and my day-to-day activities and job involves treating and taking care of patients, especially children from 0 to 18 years of age with their heart problems, who have congenital heart problems, who have acquired heart problems. So I take care of that. So I have been asked to discuss about heart health and what are the basic soft signs of heart problems in children. So let us start with the discussion. Just a minute. So I will be discussing heart health in children. What are congenital heart defects? In very simple language, we will discuss what are the heart defects in children. What are the warning signs that parents and their caregivers should know that these signs should not be ignored, and whenever these signs are present, I must consult a doctor. Whether these kids can participate in sports and daily activities, whether they can go to school, and what is the role of parents and health caregivers in keeping up their heart healthy. So, why heart health is important? We all know heart health affects our growth because heart pumps the blood to entire body. If heart is weak, our blood supply, which also carries the oxygen and nutrients to all the body, will be affected. And heart problems can be silent, like a patient or a child can have a large hole in heart or a very severe heart defect, and still he has no symptoms. He or she has no symptoms. This is possible. School age is the key time for detection, because not only school age, actually the first year of life, especially first 3 months of life are key time for detection of these problems, and early these problems are detected, better are the treatment results. So early care leads to excellent outcomes. So, as I discussed, heart pumps blood to the whole body. Blood carries oxygen and nutrients. A strong heart helps children to stay active and focused. Even as we know, the heart works continuously even during sleep. So, let us know something about congenital heart defects. What do we mean by congenital? A congenital means anything which is present by birth. ठीक है, the heart problems are present since birth, though we may detect them later, है ना, he may be diagnosed at 1 year of age or even at 10 years of age, but if the problem is present since birth, it is called congenital. And heart disease मतलब the heart diseases which are present since birth are CHDs. So many children may look completely normal, and it is one of the most common birth defect in India. So since we have tackled all other many of the heart infection in the childhood, like initially diarrheal problem, respiratory problem used to be the major health burden in childhood. But since these are taken care of by so many doctors, antibiotics, health control measures, no, this remains now the one of the commonest health problem in children. So, a congenital heart defect is a condition where the heart has not formed properly during the development in mother's womb. Congenital means the heart problem is present from birth. So, what can it be? So, a congenital heart problem can be a simple hole in heart. We may have a hole in heart and we have different chambers of the heart. The hole can be present in any one of them. There are major vessels, arteries and veins which takes the blood from the heart and which brings blood towards the heart. There can be problem in those vessels. The vessels can be tight. You know, if the vessel is tight, suppose a pipe is taking blood away from the heart and it is tight, the heart will have to exert a excessive pressure to send the blood through the body. So that pressure will cause some deleterious effect on the heart. The heart will eventually fail. We may have valve problems. So there are valves in the heart. There are 4 valves. The function of the valve is to control the direction of blood flow. The blood can flow only from one side to other side, not in the opposite direction. And this is controlled by valves. Valves are like doors. They open in only one direction. We may have a tightness or leakage in the valves. Narrowed blood vessel we have discussed, or there may be complex problem like we also have a hole, the patient also have a narrowing in the blood vessels, and he may or she have like blood vessels are connected differently, left sided vessels are connected to the right side vessels are connected to the left side. There can be any combination of these defects which becomes the complex heart problem. Then what causes heart problem? Unfortunately, we don't know what causes heart problem. Only in few cases, some drugs, medicines, or viral infections are related to heart problem in maybe 3 or 4 type of heart defects. But in majority of them, we don't know. We don't know what causes congenital heart problem. A lot of people think that either of the parents must have done something wrong. Some like parent, mother or father might have done something wrong which has led to this heart problem, but this is not the case. And let us be sure that they don't have any fault. So this is important. So we don't know whether a child is having heart problem or not, simply looking him from the outside. So we must know what symptom the child will show if he or she has a heart problem. So as I said earlier, even with the major heart defect, the child may be completely asymptomatic. He may be breathing normally, he may be playing normally and still carrying a large hole in the heart. And symptoms also tend to vary by age. At birth, the child may have different symptoms. At 3 months, 4 months, he may have different symptoms, right? So we have to see how the child is growing. So these are quite common warning signs for congenital heart defects, which if we observe in a child, we must consult our doctor. Like easy fatigability, So we can just we see that kids do tire out easily nowadays, but we must compare with their classmates, with their friends, with their brother, sister, है ना? If one child gets tired easily, regularly, this is abnormal. ठीक है? We must look at this feature. Breathlessness. So breathlessness, if the child is exerting, running fast, playing, so short duration of breathlessness is okay. That should recover as soon as the child takes rest. But persistence of this breathlessness or difficulty in breathing, even after few minutes of resting, that is abnormal. Poor weight gain. So frequently the child with this hole in the heart will show poor weight gain, right? So they will take the feeds, they will eat what they are eating, but their weight gain is not appropriate. Blueness. So we call it cyanosis. Their lips, tongues, nails, fingers are blue. So this happen in certain type of heart problem which are called cyanotic heart problems. So in this condition, the blood flow to the lungs is also affected. So oxygen is not reaching up to the blood. So that's why they become blue. Chest pain or fainting or dizziness. These are like serious symptoms which should not be ignored. How we can diagnose? Suppose the symptoms we have discussed, we have seen some kid with this kind of symptoms. Now what to do? How can we confirm whether this child has a heart problem or not? So certain heart problems, generally you might have seen there are so many scans and tests are going on when a lady is pregnant. So some of these scans do detect congenital heart problems, but not all the congenital heart problems can be diagnosed by these kind of scans. So a limited number of these problems can be diagnosed even before the baby is born. So that is quite a good thing. This test is called fetal echocardiogram, like a ultrasound. So however, after birth, we generally do a echocardiography test to diagnose heart problems, and this is a confirmatory test, है ना? So 99.9% of the time we are very sure कि what the child is suffering from by this simple echocardiography test. Who is at risk of having a child with congenital heart defect? Anyone can have a child with heart defect. So there is no way to predict whether this couple is going to have a child with heart defect. So the frequency of having heart problem in general live birth is like 8 babies in 1000 births. So you can roughly say 1 in 100 child will have some form of heart problem. If a couple already has a baby, if there is already a baby with congenital heart problem in family, the chances of getting another baby with heart problem is double. So if the normal population has one chance in 100 of getting a baby with heart defect, the chance of getting second baby with the heart defect is 2 in 100. Still there is 98% chance of having a normal baby. So see, so whenever we see a child with heart problems, so we see what are this outcome of this kind of heart defect. So according to this, we decide the treatment strategy. If the suppose a heart problem is making the child breathing very difficult, the child circulation is very low. So these kind of heart defects need to be treated immediately after birth or within first month of life. If the child is okay, he is playing around, he is growing well, then we can operate the child at around 3 to 4 years of age also. There are certain holes, very less number, there are certain holes which do close by its own. So if we know that we are dealing with such kind of hole, we keep them under observation. We call them regularly after 3 months, 6 months to see if that is getting closed or not. But somehow we decide that this child needs to be treated. There are many ways of treating the patients. We can simply close the holes and dilate the tightened vessels by angiography technique. So you might have seen in old age people, doctors put stents in the arteries. They go through a blood vessel in the arm. They put a wire with the blood vessel reaches the heart, and on that wire they take a stent and they open the arteries. A similar procedure of stents or other devices or balloon dilatation also happens in children. So we can take a wire from the artery in the leg or neck to the vessel which is tight. We can dilate it, We can close the holes by there are devices, umbrella devices. So what is the advantage of this technique? That only a minimal 1 or 2 hole is there. Oh, that too on the arm or leg. There is no cut. The patient recovers very quickly and patients are discharged very next day. Second thing, if this kind of intervention is not possible, open heart surgery is also required. Open heart surgery is a major thing in children because it is like a CABG operation. आपने सुना है ना, CABG operation होता है बड़े लोगों में, तो वैसा ही ऑपरेशन होता है. हार्ट लंग बाईपास मशीन पे डाल के हार्ट को स्टॉप करके ओपन करके उसको रिपेयर किया जाता है. But again, the success rate is quite high. So we do have a success rate of open heart surgery close to 97-98%. That is as per the world standard. So now the common curiosities. इतनी छोटी एज में बच्चे का ऑपरेशन हो गया, आपने 1 महीने के 2 महीने के बच्चे का ऑपरेशन कर दिया, अभी तो इसके आगे पूरी लाइफ है ना. द चाइल्ड हैज़ टू लिव 60-70 years, नॉट लाइक अडल्ट. इफ वी ऑपरेट ए अडल्ट एट 60-70 years of age, he has to live another 20-30 years. But a kid has a whole 70-80 years in front of him. So what is their outlook for such a long life after heart surgery in the early childhood? So for 70-80% of the heart defect, they becomes normal. The child may have a normal life, normal activity. They can participate in sports also, normal school life, normal marriage life, etc. And regular follow-up we do up to certain age, 2 years, 3 years of age. After that, we stop calling them from the follow-up also. But for 15-20% of the cases which are more complex or which cannot be corrected like entirely, 100% of the defect cannot be corrected in some cases. In those cases, they are kept on lifelong follow-up. Their physical activities, like they can still do physical activities like playing with the peers, but competitive sports they are advised to avoid, right? And they may also need future surgeries in their later life. So this is only 20% of the subset in which these precautions are required. Rest 80% are almost cured. So are the things improving in India and overall? Yes. If you see the in 1960s and 70s, the chances of survival from a cardiac surgery were low. It was close to 60-70%, but today it is close to 96-97%. There are certain acquired heart problem also. It is not like that if a child is not having congenital heart problem, he cannot get another problem. There are acquired heart problems in childhood also. One specific kind of heart problem I would like to mention is rheumatic heart disease. What is rheumatic heart disease? This happens because of infection. The valves in the heart gets infected by what? These are the throat infection or skin infection in childhood, which leads to immune reaction, which then affects our heart valves and damages the heart valves very badly. So generally a sore throat which is ignored, which is present beyond 7 to 8 days is likely a culprit. So this is very important. If there is a one take home message from this presentation is that the childhood infection, especially the sore throat है ना, बच्चे बोलते रहते हैं गले में दर्द है, बलगम आ रही है, खांसी है, समटाइम्स में कोई बात नहीं है, आयुर्वेदिक दवाई दे दी, होम्योपैथिक दवाई दे दी, कफ सिरप्स दे दिए. So if it is present beyond 3, 4, 5 days, get it treated by a pediatrician because these are not any sore throat. This is a specific type of bacteria, a streptococcal sore throat, which affects the heart valve. So this should not be ignored. There are other वायरल इन्फेक्शंस. कई बार वायरल इन्फेक्शन के बाद हार्ट में पहुंच जाता है वायरल इन्फेक्शन, तो हार्ट मसल्स गेट वीकन. ठीक है. हार्ट रिदम प्रॉब्लम्स, दिस इज अ रेयर टाइप ऑफ प्रॉब्लम, विल स्किप दैट. सो द इम्पोर्टेंस इज अर्ली ट्रीटमेंट ऑफ थ्रोट इन्फेक्शन. It should not be ignored. Again, physical activity is good for most children, and we need not to restrict physical activities, even in heart patients. Only in few selected patients, we advise against the competitive sports. So these signs we have already seen. When to seek any help, urgent medical advice. If we observe these symptoms in any of the kid, we should seek the immediate medical advice from our pediatrician or a cardiologist. So I'll say heart problem in children are treatable. Early detection save lives. And please do not ignore the symptoms and consult your cardiologist if you observe any of these symptoms. Right? Thank you so much. Hello.
Yes, sir. So if anybody would like to ask any questions pertaining
Uh,
to topics, can ask now.
yes. Can I say?
Yes, ma'am, please.
Yes, yes.
Yes. Good afternoon, sir, and good afternoon, ma'am.
Good
Uh,
afternoon.
Good afternoon.
Actually, my son is 3 years old, right? Studying in nursery. Actually, sir, I have a concern regarding his future health because his father underwent a heart angioplasty at the age of 28. And as you understand that disease can be genetic, uh,
Yes.
so I would like to know that preventive measures we should take from childhood to reduce the risk for my son, or
Yes, that is quite a common scenario and very important one. So, if there is a history of heart problem, especially this coronary artery problem in the family, so rest of the generation, next generations, and even the siblings are at a higher risk than the general population. It doesn't mean that everybody will have, but they are at the higher risk. So it is becomes very essential more than the rest of the population that you take care of his general well-being from the very beginning. You take care of his diet. Your dietary habits should be good from the beginning, because what happens, this blockage does not happen suddenly at the age of 20, 30, or 40. They start there. The base is formed in the childhood, 5th, 6th, or 10th year. And if our dietary habits are not good, we eat lot of junk food, lot of sweets, our physical activity is not good, our screen time is too good, so all this leads to formation of plaques in the arteries, which then becomes disease later on. So since you have a family history of early
okay,
blockage, you should take
okay,
care of these things very early, from very beginning, right? You should promote
okay,
healthy eating, no
okay,
junk foods, very
okay,
less screen time, and make sure that your
okay,
child participates in sports. Okay? Because a sports person is very less likely to have a heart problem. Okay? If he is regular in sports, so make sure he, now he's 3, but as soon as
yes,
like
yes,
he
yes.
becomes 7, 8, 9 years, he reaches that age, make sure to that he joins some any sport activity.
Okay, sir. And another question in my mind is, what is any heart related test or screening should be done?
Definitely. So at present, he is only 3. You need not
Okay,
to worry about that.
okay.
So, but once he reaches 13, 14, 15 years, so there are certain blood tests like lipid profile, है ना? Lipid, because
Acha, हाँ sir, हाँ.
so why your husband has got a problem so early in the life? So he might have
हाँ,
some derangement in the lipids, है ना? लिपिड्स प्रॉब्लम
हाँ,
प्रोफाइल होता है ना, वो बिगड़ जाता है, कोलेस्ट्रॉल जिसमें बोलते हैं।
अच्छा,
सो उसके लिए एक टेस्ट जरूर करना चाहिए। आपका हस्बैंड का भी वो रखा होगा, तो
हाँ,
बच्चे
हाँ.
को भी जरूर करना चाहिए।
He also he is also a sports person, sir. बहुत खेल कूद बहुत करते हैं, फिर भी
अच्छा,
ये
then it becomes like है ना, some thing related to congenital cholesterol problems, है ना? Not only the heart defects, but cholesterol problems also are congenital. Despite of having good diet and good physical activity, the cholesterol builds up in our body, and that leads to blockage, right? So we call it congenital hypercholesterolemia. So this is just an example. It is not, I'm saying that he might be having this problem. This is just an
yes,
example.
yes.
है ना? सो आपके हस्बैंड के कुछ टेस्ट हुए होंगे, तो वो
Okay.
टेस्ट को लेके तो आप अपने डॉक्टर से कंसल्ट कर सकते हैं कि क्या ये प्रॉब्लम इनको हुई है, तो मेरे बच्चे में कितना चांस है ऐसा होने का।
अच्छा, वो 13-14 एज में करूंगी।
अगर तो कोलेस्ट्रॉल की प्रॉब्लम है ना, तो वो जल्दी भी हम चेंज कर सकते हैं, बट फर्स्ट वी शुड नो व्हाट टेस्ट वर abnormal इन योर हस्बैंड,
ओके।
है ना।
वो तो अच्छा सर।
है ना, अगर तो उनके कुछ टेस्ट में प्रॉब्लम थी, फिर हम वो देखेंगे कि बच्चे में होने का कितना चांस है। अगर उनके टेस्ट में कोई प्रॉब्लम नहीं थी, फिर बच्चे में स्क्रीनिंग का टेस्ट करके कोई ज़्यादा बेनिफिट नहीं होगा।
अच्छा क्या प्रॉब्लम होने के बाद वो डिजीज मतलब एंजियोप्लास्टी करना पड़ा, वही सर पूछ रहे हैं कि?
नहीं, एंजियोप्लास्टी तब करना पड़ा क्योंकि आपके हार्ट उसमें आर्टरी में ब्लॉकेज था। ठीक
हाँ
है,
सर, हाँ।
लेकिन ब्लॉकेज क्यों हुआ? ब्लॉकेज होने के बहुत सारे रीज़न होते हैं। ठीक है,
यस सर।
जेनेटिक्स भी हो सकता है, हमारी डाइट एक्टिविटी भी हो सकती है, डायबिटीज़ हाइपरटेंशन भी हो सकता है। वैसे ही तो ये जो इतनी भी प्रॉब्लम मैंने बताई हैं, ये ऐसे किड्स में होने के चांसेस थोड़े ज़्यादा हो जाते हैं अगर फैमिली में एक जना अफेक्टेड है। ऐसे ही कोलेस्ट्रॉल प्रॉब्लम होती है जिसमें बॉडी में कोलेस्ट्रॉल का बैलेंस बिगड़ जाता है। ठीक है, वो भी अगर फैमिली में किसी को है तो बच्चे में होने के चांसेस हो सकते हैं। सो पहले हमें ये जानना है कि आपके जो हस्बैंड का
अच्छा।
ब्लॉकेज हुआ कॉर्नरी आर्टरी का, उसमें हमें क्या रीजन मिला, ब्लॉकेज क्यों हुआ? गॉट माई पॉइंट? वो ब्लॉकेज
यस सर।
क्यों हुआ, क्या हमें कोई उसका रीजन मिला?
ओके सर, वो तो नहीं पता मेरे को।
है ना, तो वो जो डॉक्टर ने ट्रीट किया था, आपके जो भी
हाँ
जिन्होंने स्टेंट किया था, एंजियोप्लास्टी किया था, आप उनको दिखाने तो जाते होंगे वो, है ना।
हाँ, यस सर, यस सर।
जब भी आप उनको नेक्स्ट टाइम दिखाने जाएंगे तो आप उनसे
यस सर।
डिस्कस करना, सर इनका ये ब्लॉकेज क्यों हुआ इस अर्ली एज पे, और क्या सेम रीजन से मेरे बच्चे को ये रिस्क हो सकता है। तो वो डॉक्टर आपकी रिपोर्ट्स देख के आपको ये बता पाएंगे कि हाँ, ये जो ब्लॉकेज हुआ इस वजह से हुआ था, तो ये इस बच्चे के ये रीजन बच्चे में होने के चांसेस हैं या नहीं है।
यस सर, यस सर।
है ना, ऐसा
यस सर।
क्योंकि रीजन बहुत सारे हैं, ब्लॉकेज होने का एक रीजन नहीं है, काफी सारे रीजन होते हैं। कुछ है चांसेस आगे बच्चों में होने के, और कुछ रीजन का चांसेस नहीं है।
ओके सर, ओके सर। ठीक सर, थैंक यू सो मच सर।
So, since you mentioned many few important things that we have to take care of, many major things will affect the heart diseases and all now. So, like adding to this point, I would like to know: is there any best balanced diet that normally people can like adopt in their regular meal so that they can avoid certain heart diseases?
See, so it's generally it is like in our Indian families, है ना, so सारी मदर से ही बोलती हैं कि घर का बना खाना दो, that is a very good habit. So kids should avoid the junk food, packaged food, processed foods. See, whatever is freshly cooked, ठीक है, डजेंट मीन कि ठीक है, प्रोटीन डाइट भी होनी चाहिए, हमारे फैट और कार गुड फैट्स होने चाहिए, वी डोंट अवॉइड फैट्स, घी भी देना है बच्चे को, और रोटी भी खाएगा, थोड़ा बहुत शुगर्स भी हम देते ही हैं। बट इफ़ यू अवॉइड जंक फूड्स, पैकेज्ड फूड, हाईली प्रोसेस्ड फूड, राइट, दिस इज इनफ, दिस इज मोर देन इनफ इफ यू मेक द चाइल्ड टू अवॉइड दीज थिंग्स। बाकी घर पे बना हुआ खाना जो मर्जी, हमारा इंडियन जो स्टेपल फूड है, वेज नॉन वेजिटेरियन सब कुछ दे सकते हैं।
हेलो।
Yes, ma'am, please.
क्या मैं बात कर सकती हूँ?
Yes,
हाँ
ma'am.
हाँ।
तो मेरा नाम शबनम, मैं हिंदी में बात करूंगी।
हम्म।
तो मेरा बेटा जब से वो बच्चा हुआ उसका, तभी से वो मुंह ओपन करके ही सोता है, सोने के टाइम भी, जब वो दिन में खेलता रहता है तब भी वैसे ओपन ही ज्यादा करता है, क्लोज नहीं रहता उसका, जैसे ऐसे बोलते ही रहता है वो। उससे कुछ प्रॉब्लम?
नहीं, उससे प्रॉब्लम नहीं है, तो लेकिन हमें ये देखना है वो मुंह खोल के क्यों सांस लेता है। ठीक है, एक तो ये हार्ट का प्रॉब्लम डेफिनेटली नहीं है। तो देखो, बच्चों को नाक से सांस लेना है, मुंह कब खोलेगा? जब नाक से सांस नहीं आ रहा। नाक से सांस कब नहीं आएगा? वहाँ पे कुछ ऑब्स्ट्रक्शन है, प्रॉब्लम है ना। तो कुछ लोगों को नोजल ऑब्स्ट्रक्शन होता है। तो नेजल ऑब्स्ट्रक्शन के दो तीन चार्ज होते हैं, तो यहाँ पे टर्बिनेट्स होते हैं हमारे, वो बढ़ जाते हैं, उनकी हाइपरट्रॉफी हो जाती है, या उसको कुछ एलर्जी रहती है ना, एलर्जी कुछ खांसी जुकाम रहता है, तो उस वजह से नोजल ब्लॉक होता है। नोज के पीछे टॉन्सिल्स होते हैं, उनको एडिनॉइड्स बोलते हैं। जैसे यहाँ पे टॉन्सिल्स होते हैं, वहाँ पे भी टॉन्सिल्स होते हैं, उनको एडिनॉइड्स बोलते हैं। अगर उनका साइज बढ़ जाता है तब भी नेजल ब्लॉकेज हो जाता है और बच्चा क्रॉनिकली फिर मुंह से सांस लेता है, राइट। तो हाँ, तो अगर तो आपको इसके लिए ईएनटी का चेकअप कराना चाहिए। वो देख लेंगे अगर टर्बिनेट्स हाइपरट्रॉफी हैं या एडिनॉइड्स बढ़े हुए हैं, उसके हिसाब से मेडिसिन देंगे। ऑब्स्ट्रक्शन, जब ये नोज का ऑब्स्ट्रक्शन खुलेगा मुंह अपने आप बंद हो जाएगा, नोज से सांस आएगा।
वो बीच में क्या होता है सर, मैंने चेक किया एक बार, वो ब्रीथ तो नाक से करता है, नोज से, टंग ऐसा ऐसा रहता है क्लोज होके। तो कुछ दिन मुंह में से जैसा सर्दी, ऐसा जुकाम होता है, उस टाइम पे थोड़ा ज्यादा होता है, मुंह
हाँ
में
वही
सांस
ना, सर्दी
लेने का।
जुकाम में। हाँ, सर्दी जुकाम में क्या होता है, नोज स्टफी रहती है ना, नोज से सांस नहीं आ पाता प्रॉपर, तो इसलिए अपने आप बॉडी का मैकेनिज्म है, बॉडी को तो सांस चाहिए। नोज बंद रहेगा तो बॉडी का अपने आप मुंह खुल जाएगा।
मतलब मैं एक बार ये से चेकअप कराना चाहिए ना सर मुझे?
अगर देखो थोड़े दिन का प्रॉब्लम है, आपको लगता है बीच में अपने आप ठीक हो जाता है, अपने आप आ जाता है, फिर तो ऐसा जरूरी नहीं है। लेकिन अगर लगातार ऐसे ही रहता है तो फिर उसकी वजह से क्या होता
तो
है, ऐसे ही
ज्यादा
रहता है
टाइम तो
लगातार।
मुंह ऐसा ही रहता है सर, वो
हाँ,
क्लोज ही नहीं करता है उसमें।
फिर एक बार चेकअप करा सकते हो, क्योंकि अगर क्रॉनिकली लंबे समय तक ऐसा रहता है ना, नोज ब्लॉक रहता है और मुंह खुला रहता है, तो थोड़ा फेशियल चेंजेस आ जाता है, फेस में भी चेंजेस आ जाता है बच्चों का। तो अगर लंबे समय तक ऐसा चल रहा है फिर आपको एक ईएनटी चेकअप कराना चाहिए।
ठीक है, दिखाइए। तो ज्यादा दिन से जुकाम नहीं रहता, जब वो जुकाम नहीं होगा तभी वो ओपन ही रहता है, इसलिए मुझे उससे।
एक बार चेकअप करा लेना चाहिए।
थैंक यू सो मच सर।
और कोई क्वेश्चन किसी का?
Anybody would like to ask any questions? Sir, I have one question. Okay,
हम्म।
during the conversation, like you were mentioning that, even like we will get the disease will be get detected. The base of the thing will be like from the grade 7 onwards. Okay, is there any symptoms to find out? We will get rectified.
Definitely, there are symptoms like I told you, na, if the child is not gaining weight, he is getting tired easily. His friends are playing, but he said, "I am tired, I cannot play." सांस चढ़ गया है, ठीक है। So his height is short, his weight is less, and he's like, if you note his finger lips, they are slightly blue, or nails are swollen, fingernails are swollen. So these are the signs, है ना। If the like his diet is okay, he is eating what he should eat, but still he is not gaining weight. So these are the symptoms which we should look for, है ना। So sometimes we get keep on ignoring the symptom, नहीं हो जाएगा, बाद में ठीक हो जाएगा। बट अगर काफ़ी टाइम से इस तरह के सिम्टम्स चल रहे हैं तो एक डिटेल्ड चेकअप करवाना चाहिए।
So thank you. Sir, sometimes what happens, even the child will not be able to like eat properly, even though the parents are very much into like yes, my child has to eat the meals complete, but children sometimes will avoid eating the food. In certain times, also the weight loss will be there. So is it going to concern a majorly or
नो,
how?
सी सी जो ये जनरल कंप्लेन है कि पेरेंट्स कंप्लेन करते रहते हैं कि बच्चा खाता नहीं है, खाता नहीं है ना, तो दैट इज ए डिफरेंट थिंग। इन दो सिचुएशन द चाइल्ड वेट इज नॉट अफेक्टेड। सो
No.
एट एवरी एज देर इज ए रेंज ऑफ वेट, है ना। अगर बच्चा 2 साल का है तो उसका वेट इतना से इतना के बीच में होना चाहिए। सो जो ये बच्चे खाते नहीं हैं वो इतना तो खा लेते हैं कि उनका वेट अफेक्ट नहीं होता। द इफ द वेट इज अफेक्टेड, वेट इज बिलो व्हाट इट शुड बी, देन इट इज़ ए कंसर्न। सो सबसे पहले अगर कोई पेरेंट्स ऐसा कंप्लेन करते हैं कि बच्चा खाता नहीं है, खाता नहीं है, ये तो कुछ नहीं खाता, तो हम बच्चे का वेट देखते हैं। मोस्टली 99% ऑफ द टाइम उस बच्चे का वेट ठीक होता है। हम पेरेंट्स को यही समझाते हैं, अगर ये कुछ नहीं खाता तो वेट कहाँ से ठीक है इसका, है ना। सो इफ द बच्चे का वेट नॉर्मल रेंज में आ रहा है, डोंट वरी। अगर वेट कम है नॉर्मल रेंज से, देन ओनली वी स्टार्ट सस्पेक्टिंग समथिंग।
Thank you, sir. Thank you for answering the question.
राइट, थैंक यू सो मच।
Anybody, anybody would like to ask any questions related to the content?
Can you hear me?
Yes, ma'am.
हाँ, मुझे सर से कुछ बात करनी था मेरे बच्चे के बारे में।
बताइए।
सर पिछले 2 दिन से ना मेरा बच्चा अभी 4 साल 2 महीना है उसका, तो उसका
हम्म
पहले लेफ्ट ईयर में उसको पेन हो रहा था, तो
हम्म
रात को मतलब पानी डिस्चार्ज है उसका कानों से। फिर
हम्म
उसका पेन भी ठीक हो गया, फिर अगले दिन सुबह उसका दाई कान में पेन होना शुरू हो गया, तो हमने एमबीबीएस मतलब नॉर्मल डॉक्टर ईएनटी का नहीं बल्कि बगल में ही एमबीबीएस एक डॉक्टर थे उनको दिखाया, तो उन्होंने फिर दवाई दिया है। वो मतलब वो खाने के बाद भी उसका मतलब थोड़ा देर पेन ठीक होता है, फिर पानी डिस्चार्ज होता है, फिर पेन बंद हो जाता है। 2 दिन से यही चल रहा है, उसका रीजन मैं जान सकती हूँ आपसे?
हाँ, ये कान का इन्फेक्शन है। इसका अगेन हार्ट से कोई रिलेशन नहीं है। उसके दोनों
हम्म,
साइड का कान में इन्फेक्शन हुआ है। जब कान में इन्फेक्शन होता है, कान के पर्दे में सूजन आती है तो काफ़ी पेन होता है। और जैसे ही उसमें थोड़ा सा वो कान का पर्दा ना, जिसे बोलते हैं पर्दा फट गया, तो ऐसे उसमें से थोड़ा सा लीकेज हो जाता है, वो जो पस इकट्ठा हुआ है वो निकल जाता है और पेन चला जाता है। तो ये टिपिकली इसको ओटाइटिस मीडिया बोलते हैं, कान का इन्फेक्शन है। आप एक बार ईएनटी वाले डॉक्टर से कान चेक करा के दवाई लो, ये ठीक हो जाएगा।
नहीं सर, नहीं सर, सुबह कुछ नहीं होता, जैसे ही शाम होता है तो उसका कान का दर्द फिर से शुरू हो जाता है।
हाँ, तो वो कोई बात नहीं, ये हो जाएगा ठीक है। कानों का इन्फेक्शन है, दोनों साइड में कान में इन्फेक्शन है उसके। तो उसको थोड़ा
जी।
एंटीबायोटिक, स्टीम, नेजल ड्रॉप्स और ये सबसे ठीक करना पड़ेगा।
जी सर।
ठीक है, हो जाएगा ठीक है, कॉमन होता है बच्चों में।
जी सर, थैंक यू।
Hello, sir. Good afternoon.
हाँ जी।
Sir, my daughter is 8 years old and she is 19 kg in weight. When she
हम्म
was born, she was 1 kg, 980 grams. So, is her weight okay?
8 ईयर्स पे 19 kg थोड़ा कम है। 8 ईयर्स पे वी एक्सपेक्ट वेट टू बी अराउंड 22 kg।
ओके सर, शी इज अ वेरी मच फसी ईटर, उसको खाने में बहुत इंटरेस्ट नहीं होता है। और सर बहुत टाइम लेती है, मतलब एकमात्र पूड़ी है जो वो थोड़ा सा खा लेगी, अदरवाइज वो कुछ भी नहीं खाना चाहती है सर, उसको कोई इंटरेस्ट नहीं है। मेरा बेटा है उससे छोटा, वो बिल्कुल ठीक है सर, उसको कुछ भी दे दो वो दिन भर मतलब उसको खाना है, खाना वाला मैटर है। बट मेरी बेटी पूरी उल्टी है सर, उसको खाने में कुछ भी इंटरेस्ट नहीं है।
हाँ, तो दिस इज ए ट्रू प्रॉब्लम है ना, कि बच्चे कुछ नहीं खाते। सो अगेन ठीक है, अगर इफ देर अगर एक्टिव रहती है वो, कोई और प्रॉब्लम तो नहीं आती।
नहीं सर, शी इज फुल्ली एक्टिव, खेल कूद जितना दीजिए शी इज वेरी मच एक्टिव। बट सर, बट खाना में उसको बिल्कुल इंटरेस्ट नहीं। एक रोटी दे दीजिए सर, वो 1 घंटा में खत्म होगा।
नहीं,
फ्रूट्स
फिर
फिर भी
आप
खा
अगर
लेती है।
बाकी सब चीज़ें ठीक है तो इसके लिए वरी करना छोड़ दीजिए। ठीक है, आप उसके
ओके
पीछे पड़ना छोड़ दो कि ये खा लो वो खा लो, है ना, वो अपने आप शुरू कर देगी, दैट
ओके
इज नॉट इशू।
सर, लेकिन जैसे बेटा के पीछे बोलना ही नहीं पड़ता है कुछ भी।
हाँ, तो कोई बात नहीं, आप उसको भी बोलना छोड़ दो। तो
हाँ
वो
सर।
बोलोगे या नहीं बोलोगे, उसने उतना ही खाना है। ठीक है,
हाँ
तो
बिल्कुल बिल्कुल।
हाँ, जब भी भूख होता है बच्चा अपने हिसाब से खा लेता है, डोंट वरी अबाउट दैट, ये सब
सर,
सिम्टम्स बहुत कॉमन है।
एक 8 इयर्स के बच्चे का डाइट कितना होना चाहिए सर, क्या रिक्वायरमेंट है डाइट का? लाइक
देखो
चपातीज एंड राइस, व्हाट इज द क्वांटिटी सर, आई डोंट अंडरस्टैंड।
हाँ, नहीं ये ना सब
लेकिन सर इसको फुसला
एज और
के
वेट।
बहला के आई कैन फीड 1.5 चपाती, सो इज इट ओके सर?
सी, मैं डाइट का स्पेशलिस्ट तो नहीं हूँ। ठीक है,
ओके सर।
लेकिन हाँ, वेट क्योंकि उसका कम है एज के अकॉर्डिंगली, और जिस हिसाब से आप बता रहे हो डाइट, तो डेफिनेटली वो कम ले रही है। बट
ओके
आपको
सर।
एग्जैक्ट कैलकुलेशन डाइट का चाहिए तो आपको डाइटिशियन को ही कंसल्ट करना पड़ेगा।
ओके
ठीक है,
ओके ओके
हाँ,
सर।
ये मैं
ओके,
नहीं बता
थैंक यू
पाऊंगा।
सर। थैंक यू सर, थैंक यू।
एनी मोर क्वेश्चंस? संध्या मैम, इट लुक्स नो मोर क्वेश्चंस।
Yes, sir. Hope any other questions would like to be asked by anyone? So, how you said, like a heart disease, we have to follow certain diet and all now, and we can detect certain symptoms also if it is early. So, is there anything like how can we detect a person is affected from the cholesterol? Even that can lead to the heart disease.
See, the cholesterol problem generally does not occur in the pediatric patients. In children, they does not occur. So it is only the high cholesterol keeps on accumulating over years and years, then it causes problem in the adulthood. So that too high cholesterol in adults, sometimes you might have seen there are accumulation of cholesterol और मसा like ऐसा white सा दिखाई पड़ता है फेस पे, eyes के पास. सो दैट इज ए साइन ऑफ हाइपर कोलेस्ट्रॉल में कोलेस्ट्रॉल ज़्यादा है, बट 99% ऑफ पेशेंट्स में उसका साइन नहीं होता है कोलेस्ट्रॉल का, और पीडियाट्रिक पेशेंट्स में तो बिल्कुल नहीं होता है बच्चों में. ठीक है, एंड वी डोंट इवन चेक कोलेस्ट्रॉल प्रॉब्लम इन चिल्ड्रन अनलेस एंड अनटिल they have a family history, like in their family there is a history of cholesterol problem, and we do not check otherwise cholesterol in children.
Thank you, sir. Thank you so much.
Right.
Any other questions? Sir, I think you have answered almost all the questions and queries, like what all the audience were having. And I would like to take a moment to extend my gratitude for you, sir. And it was a very wonderful session. Thank you so much for being with us and giving a complete insight about how to take care of our heart and how to take care of the children. So thank you so much for being with us, sir. We would like to request you for upcoming sessions also as well in all different topics, so that we can get a complete gist of information how to have a very healthy life in our life. So
Right.
thank you so much, sir.
Thank you, ma'am. Thank you, Didi.
Thank you to each and everyone for participation, and it was very nice to see like very concerned questions were asked, and it has been like clear, like very clearly cleared by the doctor. Thank you so much, everyone. I'm going to wrap.
Thank you to ma'am also.
Thank you,
Thank you,
ma'am.
ma'am.
Thank
Thank
you.
you, sir.
Thank you so much, sir.
Thank you, sir.
Thank you.